Hi, I'm Dr. Jennifer Beck, a pediatric orthopedic surgeon specializing in sports medicine. I provide care to children at the Center for Sports Medicine at the Orthopedic Institute for Children in downtown Los Angeles, along with my partner, Dr. Richard Bowen. We are also part of a large sports medicine group at UCLA Health. I would like to speak with you today about an often talked about sports injury, the ACL injury. The anterior cruciate ligament, or ACL, is one of the four major ligaments in your knee. It gives strength to your knee when moving side to side or when pivoting. Activities such as football, soccer, basketball, tennis, and volleyball are heavily reliant on your ACL. Activities in which the motion heads straight forward, such as swimming or cycling, do not rely as much on the ACL. Injuries to the ACL often happen when a player is trying to perform a sudden twisting movement, known as the plant and twist. The player plants their foot in the ground, often with their knee flexed, and then tries to suddenly move in the opposite direction. This move puts maximum stress on the ACL and can lead to injuries. While anyone of any age can experience an ACL injury, females are up to 8 times more likely than males to tear their ACLs, particularly adolescent females. A severe injury, like an ACL tear, can often be misdiagnosed as a knee sprain. This can delay treatment and can cause long-term complications to the knee joint. If a young athlete tears their ACL and tries to go back to playing a sport like soccer, they will often find it difficult. The athlete may notice that they cannot do certain movements because their knee is too weak or gives out on them. Or they feel a grinding or popping type sensation inside their knee when they try to perform these activities. These are all symptoms that should cause an athlete to stop playing and seek immediate sports medicine care. Unfortunately, most ACL tears will not heal on their own. Surgery is often recommended for athletes who want to return to their cutting and pivoting sports and to prevent long-term wear and tear on the knee joint. This surgery involves extensive rehabilitation, often up to 9 to 12 months, in order to perform sports such as soccer or football. It is not only a devastating physical injury, but can also affect the psyche of the athlete. Because many sports injuries can be avoided with proper technique, we've asked our colleagues at PT Solutions in Santa Monica to share some tips for preventing ACL injuries.
Thank you, Dr. Beck. We certainly continue to see a prevalence of ACL injuries in the young population, and often discover that most young athletes were never enrolled in an adequate preventative and sports enhancement program. A significant amount of ACL injuries can be prevented simply with the right education to develop proper awareness of good versus bad body movements, and the right training to teach the mind and body to utilize the best mechanics when it counts the most. Developing these skills can significantly reduce injury risk. And like Dr. Beck said, incorporating training to prevent an ACL injury can help young players and their families avoid costly surgery and lengthy rehab time. So how can you prevent an ACL injury from happening? There are contact and non-contact ACL injuries. Contact injuries are due to an external force, such as when the knee is hit from the outside in, whereas non-contact ACL injuries are due to the player performing an injury-causing movement, which Dr. Beck referred to as the plant and twist. This is most commonly seen with a classic yet explosive change of direction, such as cutting in football and soccer, or pivoting in basketball. During this movement, the player is not able to control the inward or valgus motion placed on the knee, thereby stressing and possibly injuring the ACL. Non-contact ACL injuries are the most common. The good news is that non-contact ACL injuries are also the ones that we can prevent the most. Dr. Davi is going to share some detail on proper landing mechanics, identifying and training specific muscles that protect the knee joint, and will share our recommended 3-step injury prevention and sports enhancement training program offered here at Physical Therapy Solutions.
Basic physics has taught us that every action will have an equal and opposite reaction, and your landing mechanics are no different. So if force equals mass times acceleration, then each time you jump straight up and land, the ground is sending a force the equivalent of your body weight times 9.81 meters per second squared back up through your body. This is known as the ground reaction force. Proper landing mechanics require several muscle groups throughout the leg to work in sync with each other, simultaneously lengthening in order to redistribute the weight evenly throughout the ankle, knee, and hip joints. When done successfully, injury is prevented. The best way to think of this is as a soft or light landing. A soft landing will consist of smooth and controlled dorsiflexion at the ankle, flexion at the knee, and flexion at the hips. Other important components to the landing are knee alignment and becoming glute dominant over quad dominant. Think of your knee as a joint that should only flex and bend or extend and straighten. Previously discussed valgus movement that can happen at your knee during landing is a sign of gluteal weakness and places a tremendous amount of stress at the ACL. Becoming glute dominant with your landing consists of sitting into your landing. As you land into a squat position, you should be able to see your toes. If the knees have migrated over your toes, your quad muscles are doing a majority of the work of landing and leading to more abnormal stress at the front of the knee. Your gluteals are some of the larger and stronger muscles in your body, and they will become much more active when landing with a butt-out posture. There are specific muscles used at each joint that can be isolated and trained to help prevent ACL injury. So let's start from the bottom up. At the ankle, the gastroc-soleus complex, or calf muscles, allow for controlled dorsiflexion. You can isolate the gastrocnemius by performing heel raises with the knees straight, and you can isolate the soleus by performing heel raises with the knees bent. At the knee, the quadriceps control knee flexion, and they can best be isolated with seated leg extensions and straight leg raises. As we discussed earlier, these muscles should not be the primary workers, but they will still benefit from strengthening as they are active in the movement. At the hips, the hamstrings and gluteal muscles will control hip flexion and adduction, or the valgus movement. There are a variety of ways to train these large muscle groups, including bridges, lunges, squats, lateral walks, and other sport-specific exercises. I will now share our recommended prevention and sport enhancement program, broken down into 3 steps. The first step consists of isolated muscle exercises. These exercises are best for returning from injury, or if you are having difficulty finding your proper landing mechanics. If you cannot seem to keep that knee from diving in when you land, isolating your glutes may allow for improved control without as much of the concentration component. Step 2 will consist of more functional activities with movement at multiple joints. This is a middle level where the athlete can focus on the eccentric or slow and controlled lengthening of muscles to prepare for level 3. Step 3 will consist of sport-specific and plyometric type activities where the athlete must disperse the ground reaction force and quickly create another explosive force in preparation for the sport-specific movement. Here are the specific exercises that could be used in each step. Step 1 could consist of single or double leg heel raises, straight leg raises, straight leg abduction, clams, bridges, and standing hip extension. Step 2 could consist of squats, wall sits, lateral walks, single leg squats, pistol squats, and lunges. Step 3 could consist of squat jumps progressing to box jumps, single leg hops, which are great for runners, lateral shuffles, and others. Level 3 will quickly become personalized to the athlete's individualized sport, focus on the demands of a game at their position. So a runner or soccer player would be doing primarily single leg activities, whereas football and basketball players would still benefit from double leg activities as well as single leg.
To learn more about our prevention and sport enhancement programs, visit us at www.ptsolutionsla.com. We highly recommend scheduling a physical therapy evaluation to determine if you are at risk for injury and to learn what you can do right away to reduce that risk.
Hopefully, in these brief few minutes, you've learned some tips to grow well and play well. If you need more information or have questions, please go to ortho-institute.org or make an appointment with myself, Dr. Jennifer Beck, or my partner, Dr. Richard Bowen. You can also see any of the sports medicine physicians at the UCLA healthcare sites. Thank you so much for listening and watching, and have fun on the field.